Well, hello and welcome to another Move with a Doc. I'm Dr. Rupa Shah, family physician, and we are going to chat today about strength training or endurance training. As usual, well, maybe a little deviation from usual. Feel free, I always say, to move and stretch, but today I would say feel free to grab a weight or some resistance bands and do some strength training while you're listening. So what do we mean by strength training? This is really any exercise in which you use your body weight or some kind of equipment, dumbbells, resistance bands, or anything like that to build muscle mass, okay? You're building muscle mass, you're building strength and endurance. This does include yoga because you're using your own body weight. And of course, the free weights at the gym, the machines at the gym or in your home gym, those all count. Even circuit training where you alternate like aerobic exercise with strength building exercises, that also counts. So basically anything where you're increasing your muscle size by using weights. And when you increase that muscle size, we call that muscular hypertrophy, okay? One of the things that's really surprised me over my 20 plus years in practice now is how most folks, but particularly women, don't really include strength training into their daily workouts. And they don't even recognize the huge benefits that it can have on both your body and your mind, and especially your metabolism. So every day I get asked this question from my patients: how do I lose weight? And, when I ask them, like, well, what types of exercises are you engaged in currently? They'll usually say, I do a lot of walking, I walk my dog, I do a little bit of maybe aerobic or cardio type of activity a few times per week. And then they're frustrated by the lack of their weight loss or the progress they're making. But what I always note is that they have not said anything about actually doing any strength training as part of their regimen. I think there's a variety of reasons for this. I've kind of speculated in my mind why I see such a dichotomy between males and females sometimes. And I think sometimes it's intimidating for women, at the gym to go into the weight room. Maybe maybe they were never taught how to use proper weights or know the proper exercises, and just don't have the know-how. And oftentimes I hear women say too, I don't want to bulk up and look more masculine, but truly that's not going to happen with the right kinds of weights and just some minimal strength training. So I think there's a certain type of bias towards men too, that it's okay for them to be strong, to build muscle, to be in the weight rooms. And the same really, I don't think happens for women. The one caveat to that, what I've noticed in my own gym where I go, is that some of the high school athletes, a lot of those young ladies are in the gym. And I wonder if it's because, again, they've learned how to use some of these machines. As a high school swimmer, we started each workout with all the weight machines at heavy weights. We learned how to use them. We learned how to increase our weights. We learned proper mechanics. And it really did make us stronger, faster, and increased our endurance. So that's just a little ad lib there, but my hope really is that more young women will start becoming more comfortable in the weight room and not feel intimidated by sort of that male presence in the weight room. So let's get into it and talk a little bit about why it's important to do strength training. What are some of the benefits of it? And you hear about it, you maybe should be doing it, but you haven't yet. So one of the biggest strengths, really the biggest benefits in terms of is really in terms of weight sort of management, and is that when you start strength training and you're building that lean muscle mass, as we call it, you're gonna burn calories more efficiently. So that's a real big benefit for both men and women. Having more lean muscle mass versus adipose or fat tissue is gonna increase your resting metabolic rate. And it's really hard to increase your basal or resting metabolic rate because it's sort of this, you're kind of born with it. But you can move the needle a little bit by having more lean muscle mass. So muscles are just metabolically more efficient than fat mass, and they do allow you to burn more calories at rest. So that's a huge benefit. And you can think of this in terms of like a man and a woman, if they go on the same sort of calorically restricted diet plan, the male is typically going to lose more weight more rapidly than the female, just given their inherent more lean muscle mass that they have. And that's thanks to their, testosterone. But second, research also shows that your metabolic rate can be increased for at least 72 hours after some sort of strength training exercise. So this means that you're still burning additional calories hours and even days after a good workout. I always think of it like that muscle soreness that I have for a day or two after my workout means that it's still burning some extra calories. So increasing your lean muscle mass can also help decrease your insulin resistance. This is a really big buzzword that you may hear about and you may not be sure what it means, but we do not want insulin resistance. This is what leads to type 2 diabetes, prediabetes, and a whole host of other health problems. What we want is to decrease our insulin resistance. And we want to see, once that happens, we want to see some of that abdominal fat sort of start to shrink as well. So let's think of this another way. Having more lean muscle mass can increase our insulin sensitivity. That's what we want. So if you have diabetes, let's say, then you're going to be better able to manage your blood sugars. The muscles take up the circulating sugar rather than just depositing it into your fat tissue or your adipose tissue, as we call it. So overall, you're going to have better glucose control, lower hemoglobin A1C levels, and just overall improved diabetic control. So if you don't have diabetes, that's just one example, but if you don't have diabetes, strength training can actually decrease your risk of getting diabetes. I just said having more lean muscle mass can improve your insulin sensitivity. So there was one study that showed a 30% risk, a reduced risk of developing type 2 diabetes among those women that participated in strength training compared to those who did not. So that to me is super impressive. Now earlier I mentioned, I talked about abdominal fat. And remember, strength training can also help shrink some of that abdominal fat through improving our insulin resistance. So what's so bad about abdominal fat? Well, it's the worst kind of fat because our abdominal waist circumference, or our waist size basically, is linked to visceral fat. And visceral fat is the fat that's around our organs. And I think we've talked about this before. Well, we don't want visceral fat. We don't want fat around our heart, our liver, our kidneys. This can lead to heart disease, fatty liver, non-alcoholic fatty liver disease, type 2 diabetes, and even cancers. So we don't want visceral fat. So again, strength training can help reduce that abdominal waist circumference and help with that visceral fat too. So super important to have as a component of your workout regimen. Now, multiple studies have also shown that strength training exercise can decrease your blood pressure, help lower your total cholesterol, and that bad cholesterol, the LDL. Remember, when you get your lipid panel, you're going to see a set of numbers there. You can, everyone's eyes go to the top number. What's my total cholesterol? That's important. Look right below that. What are your triglycerides? Are those elevated? That's the fatty portion of your blood. Go down one more line. What's your HDL? The high density lipoprotein. That's your good cholesterol. You want that to be higher. And then finally, the last line should be what's your low density lipoprotein, your LDL, and we want that lower. So again, strength training can help with that, lowering that bad cholesterol too. We know it can help improve blood circulation, which can just help strengthen your heart and the blood vessels. So lots of heart benefits of strength training. Again, can help decrease insulin resistance. I'll just keep saying that because that is so critical. Really, insulin resistance just leads to, of course, diabetes, but just increases the risk for so many other health problems. So So now we talked a little bit about just in terms of the insulin resistance, heart healthy benefits, but what are some other, benefits of strength training? Because there are some. It's not just all related to chronic disease. Um, so in women, of course, strength training can help build stronger bones and help prevent osteoporosis. So you've heard your physician probably say, to engage in some sort of strength training, exercise. And especially this is true if you have a family history of osteoporosis, you definitely want to include some strength training and then make sure you're getting adequate calcium and vitamin D too. But definitely be sure that you're adding in some strength training into your exercise routine, not just doing purely cardio exercises. Another thing that I think is important is when we strength train, it really, I mean, physically we get that muscle hypertrophy, our muscles get larger, so we are getting stronger. But I think there's actually just a real mental um, benefit to this too. I think we get a boost to our dopamine and other endorphins, of course, as we exercise, like with any sort of exercise. But I think there's a special kind of component to strength training. I think when you feel stronger physically, which you are of course getting with strength training, I think that translates over into some mental boosting and just feeling a little bit more self-confident and having a little bit more self-esteem and just feeling like you can kind of conquer anything. So I think there's some real psychological benefits as well. Lastly, strength training also can actually help with flexibility and mobility because you're increasing your joint range of motion, which then can allow for greater mobility and flexibility. And then when we have better mobility, we actually have less risk of falling and injuries. We have better balance and therefore increased quality of life. So this time of year, I always think about this a lot because the number of slip and falls on the ice that we will see in the clinic and in urgent care is just gonna be exponentially increased. And I always wonder, if people had a little bit better balance and mobility, if some of those falls may be prevented. Of course, not all of them, but I do think there's benefit in improving that aspect of our health, which when we're just doing cardio, you're not really getting. And I'll just add up for a second here, but one of the things in the gym that you can actually do is take some weights and do it on a Bosu ball. I do this quite a bit. You can do it where the rounded part, you're like standing on the dome, which is um, good, or you can flip it over the Bosu ball and then you stand on that flat part. So you're totally wobbling. And then you can try and just do some like overhead presses, bicep curls. So you're getting a little bit of strength training, but you're also starting to work on your core and getting your balance. Try it, but if you try it next to a wall so you can hold on to something. It's really difficult, but it's a great way to kind of work on that. And I would say, let me back up. Start with the Bosu ball, just working on your balance, no weights. Okay, so that's step one, of course. And then as you get better at your balance on both sides of the Bosu ball, then maybe add in some weights. Finally, just today's talk, what I wanted to touch on was an additional benefit that's a little bit newer, kind of in the mainstream media, and one of kind of the newer benefits that I'm also just learning about, but it's super fascinating. So we all know, and I sort of discussed how weight and strength training can help us lose weight, maintain weight, increase our insulin sensitivity, prevent heart disease, prevent osteoporosis. But I really want to highlight too some of the brain benefits of strength training. And there's just a lot of research being done into this as it sort of relates to Alzheimer's dementia. So there's some new research that people who engage in strength training may actually have better brain health and protection against some age-related cognitive decline. There's been multiple studies in older adults that have pointed to significant improvements in cognitive functioning. So we're talking about processing speed, memory, and executive function after they participated in a strength training program compared to study subjects that did not participate in it. So it's thought that strength training might have some neuroprotective effects, such as improved blood flow, to the brain, reduced inflammation, and this is what I found interesting, an increased expression of a factor called brain-derived neurotrophic factor. So for short, BDNF, okay? And this BDNF, this brain-derived neurotrophic factor, is linked to memory and learning. So the mechanism is thought to be that there is a hormone that we induce when we're physically active, and it enters the brain where it triggers a signaling cascade that modulates some of our neuronal function. And one of the messengers was discovered back in 2012, and it's a fancy word, but I'll tell you, it's FNDC5 irisin. Anyhow, this messenger then is sent from our muscles to our brain while we exercise. And what's fascinating here is that levels of this messenger, this FNDC, is actually reduced in patients with Alzheimer's dementia. So of course they worked it backwards to see, what can sort of improve this. So it seems that this FNDC irisin is involved in sort of important signaling cascades, and it helps regulate gene expression, again, required for what we call synaptic plasticity and memory function, but overall just improved brain functioning. So they did a study in mice where they put them on this daily swimming protocol. And what they found is those mice that participated in this daily swimming protocol protected them from synaptic impairment and memory loss. And those mice actually did have higher levels of this FNDC5 irisin levels in the brain. So it's just a start, but these findings do seem to pinpoint that there is an exercise-induced peripheral hormone that can reach the brain, which can then maybe protect against what we call are these amyloid beta oligomers. Basically, it's the neural tangles and plaques and stuff, what we see in Alzheimer's disease, essentially. So it might help with synaptic and memory dysfunction. So does this apply? This study that I'm referring to, this article actually referred specifically to folks that engaged in muscle strength training, not just general cardio activity. But of course, we know that there's research too that shows that even cardiac activity can help modulate that too. So I thought that was interesting. But anyhow, if you well, as you continue to exercise into the new year, or even if you're just thinking perhaps a little bit about how you want to start the new year off and a new routine for 2023, I hope you will consider just adding a little bit of strength training into your workout, because as we discussed, the benefits are quite astounding, and maybe even just more that we don't even know about yet. The recommendation is to aim for about 2 days of strength training per week, included with your 150 minutes of aerobic activity per week too. And I'm going to say this is super important. If you're just starting out and you've never done it, like we talked about before, you maybe don't know how to use the machines or what kind of weights, it's really important that you avoid injury, right? So it's a good idea, I think, to perhaps meet and get together with a certified athletic trainer at your gym to really get started on a good routine. So you're starting at an appropriate level for yourself. And just so you're making sure you're getting a total body workout. You're working upper muscles, you're working your lower, your quads, and some other muscles as well. So and just a little plug for those of you parents at home that are listening. If you have teenagers at home, encourage them, of course, to get their 150 minutes of exercise a week, but also encourage them, and I'm talking about older, high school age kiddos, to start doing some light muscle strength training as well, making this normal, natural part of their exercise routine. I think if we can do this at a young age, it makes it really easy for them to continue it as they get older. And I think it can be really fun to go to the gym with your teenagers and almost, maybe they know more than you, and to kind of show you some new exercises and things. So I know my daughter and I like to, go to the gym together occasionally. And it's really nice when I see some great female representation in the weight room. So anyhow, Thank you so much for joining in today. If you have any questions afterwards, feel free to email me. And of course, we'll leave some time here at the end, and I'll take some questions in the chat if you have them. Thanks.